Hello, we are Sienna, Maggie, and Sejal, and this video is dedicated to the Reconciliation Calls to Action for Health.
We recognize that we are living on the traditional lands of the First Nations Musqueam, Tsleil-Waututh, and Squamish.
We want to spread awareness by presenting this video and spreading awareness on 4 selected calls to action. Call to Action 21. We call upon the federal government to provide sustainable funding for new and existing Aboriginal healing centers to address the physical, mental, emotional, and spiritual harms caused by residential schools, and to ensure that funding in Nunavut and the Northwest Territories is a priority.
Have you had experience with traditional healing centers? What were some of the things of note that you would like to share? What in the healing center made you feel better or worse compared to other treatment facilities? And what do you think the facility could have done differently?
I assist with some Indigenous offenders who go to treatment centers that are Indigenous focused, and that support for them is very good. It supports them in a traditional way. They have elders there. They have Indigenous staff there who walks them through the program. They have traditional ceremonies like sweats and cold water baths that help with spirituality when they're going through their addiction, because often addiction in treatment centers is not about just the addiction, it's about the trauma. In terms of healing traditional medicine, I can say that not a center, however, in Indigenous practice, my grandmother had, Marie Ryan, she had throat cancer in the 80s, and they gave her 6 months to live. She met with one of her Indigenous medicine people who advised that her family needed to go and harvest Devil's Club and peel the bark because it's filled full of prickles. Peel the bark off, break down the wood itself, and boil it for 8 hours. By boiling it for 8 hours, it reduced down to a very dark golden yellow color. And my grandmother drank about 8 ounces of it every day while she was in the hospital. And to the hospital's surprise, her cancer went into remission. So I definitely believe that traditional medicines have their value. I know that some of the medicines have since transferred to our medical system. We have psyllium, it basically looks like a weed in people's backyards. People use that for your digestive system. We've been using dandelion forever, but now it's considered a very important detox for your organs. And of course, there's willow bark, which we've been using for eons, and it's something that's used as aspirin in medical and common Western medicine.
This call to action is currently in progress with projects underway. The negative impacts of residential schools were tremendous. Intergenerational trauma is the collective trauma experienced by several generations of a family or community due to a horrific event that caused initial subjects emotional, physical, or mental suffering. The damage caused by residential schools is said to last at least 2 generations beyond the former students. The abuse and assimilation tactics used in these schools gave rise to students with intense mental disorders such as PTSD, anxiety, and depression. On top of that, residential schools did little to help Indigenous individuals integrate into Canadian society. Instead, they were pushed into unfamiliar surroundings after being stripped of language, culture, and identity. As a result, negative emotions from residential schools are internalized and then projected onto family members or themselves. This becomes a perpetual cycle of abuse and neglect passed down through the generations.
The lasting effects of residential schools can also be evidenced in statistics. It is reported that Inuit people have a suicide rate 5 to 25 times higher than that of the general Canadian population. Nunavut, the province with the largest Inuit population, has one of the highest suicide rates, not just in Canada, but in the world.
My family has experienced suicide, and this was before I was born. My parents had a boy who unfortunately took his life at a very young age. And my family has been like broken ever since. There hasn't been a closure to anything, and I feel like my family is just one of the many families out there that hasn't put closure to their loved ones because it's just too hard for them to do it. Because suicide is a very common thing up here.
Our government is taking no form of like ownership for literally all of Nunavut's history. Everything is connected. Like nutrition is connected to mental health. Residential schools are connected to mental health.
It has been reported that 27% of deaths in Nunavut was due to suicide since 1999. In the past decade, the recorded age range of suicide was as young as 10 years old to as old as 63. Studies reveal that among those who took their lives in Nunavut, most of them had a history of child abuse, depression, or other mental health disorders, and heavy alcohol and marijuana usage. These are horrifying numbers and just goes to prove the devastating trauma that residential schools have created. On October 17th, a national toll-free First Nation and Inuit Hope for Wellness helpline was launched by the federal government. It was available in English, French, Cree, Ojibwe, and Inuktitut after the Ontario Cree community of Ottawa-Piscat declared a state of emergency after a devastating wave of suicide and attempts. In 2019, the federal budget, along with donations from the Nunavut government and Inuit affiliates, dedicated funds to the construction and operation of a mental health and substance abuse treatment facility in Nunavut. This is especially important because there are currently no treatment facilities in Nunavut. The closest culturally sensitive healing center is in the Mami Sarvik Healing Center located in Ottawa, which is completely inconvenient and hardly accessible. This new center, a 24-bed trauma and addiction treatment facility, is to be called Aquasariak, which in Inuktitut means a trail you go through to reach your destination, a fitting name to represent recovery and healing. In total, investments for the center reach $83.7 million, $42.1 million of which is from the Government of Canada, and the other $41.6 million is provided by the Government of Nunavut. Nunavut Tungavik Incorporated dedicated an additional $5 million to the project. Overall, $11.8 million was donated by the Makigiakta Inuit Training Corporation towards the training of Inuit counselors. Indigenous Service Canada devoted to providing $9.7 million per year for the operation of the center. Construction on the center started in 2023 and is expected to finish in 2025.
Holistic mental health centers are one of the most suitable ways to help improve Indigenous mental health. Contrary to the Western medical beliefs that the mind and body are separated, the Indigenous culture views mental wellness as a balance between family, community, and environment, encompassing the body, mind, soul, and spirit. It's this divergence in beliefs that makes the Western healing facilities unsuitable for people of other cultures. Within these Indigenous healing centers, treatment plans often consist of a combination of traditional healing practices, such as the medicine wheel, smudging, cleansing, singing, and ceremonies with the standard clinical mental health practices. Having services that are more in tune with your culture can help individuals become more receptive to getting help. In these healing centers, there's a sense of community, belonging, and similarity that can help promote more effective treatment and improvement. Overall, in order to address this call to action number 21, the federal government has dedicated over $350 million towards Indigenous treatment facilities, particularly concentrated in the Northwest Territories and Nunavut. Notable projects include the Aquasariak, as mentioned, and the Isuarvisig Regional Recovery Center in Kuujjuaq, Nunavut. The Isuarvisig Regional Recovery Center has been funded by the federal government since 2018 with $6.5 million. Additionally, the government has also stated other plans including the Federal Pathway to Address Murdered and Missing Indigenous Women and Girls, a commitment by the Government of Canada released on June 2021.
In this commitment, the government promised to address the well-being of Indigenous peoples, particularly women, girls, and members of the 2S LGBTQIA+ community through funding for Indigenous cultural spaces that are accepting of people with these identities. They also promised to accelerate the implementation of the Indigenous Languages Act, as well as to invest in data and statistical research towards Indigenous racial and social inequities in order to make evidence-based policies and services. Along with this, the Government of Canada will also investigate the resources of the Correctional Services Canada Rehabilitation Healing Lodges for Indigenous women to understand the extent of resources needed for effective treatment. These are all very solid promises, but it all comes down to whether the government can carry them out and the speed that they do so. Call to action number 22. Recognize the value of Aboriginal healing practices and use them in treatment of Aboriginal patients.
Do you feel more at ease knowing that you have the option to be treated using methods other than Western medicine?
I feel pretty fortunate that I have Indigenous elders, medicine people who have traditional knowledge of our natural medicines. And it's a gift that I carry for myself. I know that I have a cousin who works really closely with traditional medicines. She often takes care of all of us with her natural remedies. I have elders within the employment that I have that also understands traditional medicines and how good they are for you. And I'm grateful to have them. And I think that they should be more considered for more people, especially for the Indigenous folks that value that opportunity.
Overall, this call to action is being driven by the Canadian Medical Association, the Royal College of Physicians and Surgeons in Canada, and the Canadian Nurses Association. Call to action number 22 goes hand in hand with call to action number 21. As mentioned before in this presentation, Indigenous health is holistic and encompasses the spiritual, mental, physical, and social well-being. They both highlight the importance of these services to encourage individuals to get the help they need, as well as to provide comfortable and not racially discriminative treatment settings. However, Call to Action 22 is slightly different in that it encompasses the Canadian healthcare system on all levels. Released on June 2021, the Canadian Nurses Association made a commitment in the Declaration Against Anti-Indigenous Racism in Nursing and Healthcare to recognize the value of Aboriginal healing practices and work to incorporate them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders when requested by Aboriginal patients.
To emphasize the importance of this call to action, a peer-reviewed analysis of Indigenous-led health partnerships released by the Canadian Medical Association journal quotes, "Emerging evidence suggests that Indigenous-led health service partnerships improve holistic health outcomes for Indigenous peoples, as well as access to care, prevention uptake, and adherence to care plans." And they go on to say that healing specialists, knowledge keepers, and elders who are skilled in understanding and working within Indigenous cultural worldviews and determinants of health are increasingly needed in medical partnerships, decision-making processes, and patient care. Since healthcare is such a broad category, starting from 2021, the Canadian government has been working on addressing various topics such as the social determinants of health, poverty, employment, education, social support networks, housing, physical environments, and early child development. Methods to address these issues vary depending on the location, topic, organizations involved, and much more distinctions. For example, the Manwazing Ontario Health Team and Espanola Regional Hospital and Health Center Agreement signing ceremony, in which the health organization and hospital will work together to integrate Indigenous cultural knowledge and health practices into treatment of Indigenous patients in northeastern Ontario.
Following this example, it would be best if hospitals over Canada also partner with local Indigenous-focused or led health organizations to deliver culturally adequate healthcare. This gives hospitals more insight, better catering to the surrounding community's demographic, and to get a better scope of what needs to be done to effectively address this call to action. Additionally, municipal governments could also review and release articles of specific and detailed resources and programs that Indigenous communities within their regions can utilize. This includes explaining how to sign up or access these services, who to contact for additional information, and what the program specifically targets. This suggestion is made because of the lack or difficulty to obtain such information online. Identify and close the gap in health outcomes between Aboriginal and non-Aboriginal communities.
Have an opinion or experience with medical care as far as access and quality of care on a reserve?
I personally don't have an experience when it comes to quality of care on a reserve due to the fact that my experience was urban. However, I have an opinion, and I can say that I'm familiar with the farther away you are from an urban environment, the more difficult it is for Indigenous people to access quality support. In the way our medical system is set up now, we don't have a lot of nurses and doctors that are readily available in our more rural environments. There's not enough incentive for them to stay in smaller towns when they can make just as much, if not more, in a more urban setting. It's unfortunate, but it's a definite reality.
According to many statistics, Indigenous people have had continuous health issues with little help. Vital data to address the healthcare needs of Indigenous individuals, such as updated statistics on infant mortality, suicide, life expectancy, chronic disease, and the availability of health services, either doesn't exist or are not acted upon. For example, illnesses such as arthritis, diabetes, or asthma have had higher percentages in the Indigenous population versus the non-Indigenous population, resulting in 1 in 10 Indigenous people being affected by these illnesses. This is just one of the many health disparities that the government has failed to address. According to a survey done in 2021, 23% of the Indigenous respondents stated they've always received poorer service than others. 24% of the respondents said they were treated as though they were dishonest. 26% said they were treated as if drunk or were asked about substance abuse, and 14% were treated as if bad parents. These survey respondents, among many others, have had to deal with stereotypes and issues like these all over Canada, and by talking about it and raising awareness, we can begin a change.
Community engagement is one of the best ways to ensure change is made on these matters. Educating people who weren't aware and encouraging the government to act and provide resources for this cause will help put an end to this issue. Another factor that contributes to the health disparities between Indigenous and non-Indigenous people is the lack of healthcare services available for Indigenous peoples in remote communities. This makes it difficult to seek medical assistance, as well as a lack of resources in their communities. This is one thing government funding can substantially improve. With funding available, Indigenous communities will be able to access much-needed medical resources. Funding can also be put to further educating medical professionals on Indigenous history and culture to diminish stereotypes and improve patient care.
As for the current progress, Indigenous Services Canada states that they are currently working with Statistics Canada and the Public Health Agency of Canada, as well as Indigenous organizations such as the First Nations Governance Centre to construct health indicators that can detect health gaps and be regularly reported. The First Nations Information Governance Centre is currently working towards finalizing a scan and assessment of health frameworks and indicators organized by Indigenous academics and groups. However, this review was delayed due to the COVID-19 pandemic. After this review is done, these materials will serve as the foundation for future choices and policies that will cover social inequalities of First Nations both on and off reserve, Métis, Inuit, and 13 other socio-demographic groups. The Government of Canada is currently conducting a review of the Non-Insured Health Benefits Program with the Assembly of First Nations to identify and carry out initiatives that improve client access to health benefits, identify any gaps in the benefits program, and to simplify service delivery to better meet the needs of patients.
While true that the plans of the government seem reasonable, progress on this call to action has been heavily stalled, whether to do with COVID-19 or the exclusion of pivotal parties from important decision-making events. On June 25, 2023, First Nations organizations were excluded from a meeting between federal, provincial, and territorial governments addressing the funding of Canada's healthcare system. The FSIN organization stated that there is no reconciliation for First Nations, and we continue to be excluded from these crucial discussions and decision-making processes. We can hope to see the government address this, as we believe inclusion of First Nations voices are vital for reconciliation. Call to action number 24. Require all medical and nursing students to take a course dealing with Aboriginal health issues.
How does having healthcare professionals learn about Indigenous history, rights, and healing practices make you feel in regards to safety and acceptance?
I love the concept of our healthcare professionals learning about Indigenous practices and health systems. But more importantly, I feel like we need a lot more Indigenous people who are in these systems who have the experience of both traditional medicine as well as, you know, our traditional, so not traditional medicines, rather, but our typical Western medicines. And if not that alone, at least if they had a traditional medicine person who was also working side by side by Western medicine practitioner, so that they can incorporate that support together.
Your first thought about this call to action was probably, well, what will this course entail? At least, that was my first thought. While researching, it became apparent why they would feel the need to implement this call to action and what the importance of it was. This course is said it will contain material on the history of residential schools, the Declaration on the Rights of Indigenous People, treaties and Aboriginal rights, and Indigenous teachings and practices. This will require skill-based training in intercultural competency, conflict resolution, human rights, and anti-racism. This is needed for understanding how to treat Aboriginal patients. It's important that nurses and doctors know how to provide effective care to all patients, but to actually succeed at this extra step is needed. Indigenous people have historically faced a lack of health services or an unpleasant experience in a healthcare facility. Experiences such as racism or a lack of acceptance of Indigenous health models and practices. Statistics have shown that since colonization, Indigenous people have persistently faced worse health outcomes than those who are non-Indigenous, with the life expectancy of Indigenous people being 10 years less than the non-Indigenous. This shows that our healthcare system is obviously doing something wrong in their treatment of Aboriginal patients and needs to change to better support Indigenous lives.
Have you ever felt that you were treated differently, negatively, in a healthcare system setting due to your ethnicity?
I can't say that I feel that I've had that experience where I've been treated differently, but again, this goes back to me and my skin tone. However, with dentistry, I've felt that way, and basically by looking at my my coverage through Department of Indian Affairs, that's what it used to be called. It's been changed recently. I had a dentist who often would share excitement about my coverage and do work on me like root canals or crowns or even gum reduction. And I didn't need the work done. I later learned with a dentist in many years later that he was surprised to see so much work done in my mouth. And that's an experience that I've shared with many Indigenous friends and family, and they've had the exact same experience. And it's created a lot of fear amongst Indigenous folks. Our coverage hasn't changed much since then, and as a result, most dentists will expect payment first, and then you have to submit your paperwork to First Nations Health Authority, Department of Indian Affairs, it's now called Indigenous Services Canada. However, based on the income of most Indigenous folks, a lot of Indigenous folks, they don't have the ability to pay for the service first and wait for a refund. So instead of getting taken care of, they don't do it at all.
This course is a step in the right direction to help Indigenous people feel safer and better cared for. Research says that feeling culturally safe empowers patient decision-making. This results in a good relationship between the patient and the provider, where they can work together towards effective care. This will also provide diversity in free healthcare facilities that have been historically dominated by Western medicine. With this course teaching Indigenous healing practices, hospitals can reach a broader community. Indigenous people statistically face the highest level of poverty, and Indigenous healing centers are not a part of our free healthcare system. This means Indigenous people who are living in poverty can't access the healthcare they want. But now that hospitals are including these practices, they can help a wider variety of people.
This call to action is currently in progress with projects proposed. As this call to action needs to be integrated into the healthcare system, there's speculation on what the best method of teaching is. Educators would not only have to teach Indigenous content, but there is a high possibility that they would have to teach it in a traditional Indigenous manner. For example, the use of stories and oral history. These stories can be used to teach about the world, history, and cultural values. It is also important that effective education includes Indigenous knowledge systems that do not exclude or discredit other cultures, so that both non-Indigenous and Indigenous students can have the opportunity to see Indigenous perspectives and the gifts of First Nations. Of course, when trying to integrate something new, it comes with a set of challenges, and this is no different. When learning something, it's best when it comes from the source, which is why when teaching Indigenous knowledge, especially health, it's best if the teacher was Indigenous themselves. However, there is a lack of Indigenous educators because only 4 to 6% of teaching graduates are Indigenous. There's also the problem of time. Medical schools already require a lot of courses to be taken, and by adding an Indigenous health course, it could be very time and energy consuming, and it would be a lot for students to juggle. There's also the problem of physical space. More courses means more classrooms, and some universities or colleges may not have the funds to build more. These challenges might seem difficult to overcome, but with a little determination and coordination, it is highly possible. So how far along this call to action are we? Well, 8 years after the publishing of the calls to action, Surviving Hate, which was an investigative journalism project, contacted all 17 medical schools and 44 nursing programs in Canada to check on what progress was being made. Here are the highlights.
6 of the 16 schools have a dedicated course in Indigenous health, while 9 have committed to embedding Indigenous health content throughout their 4-year curriculum. 11 out of 16 schools provide students with the opportunity to complete placements in Indigenous communities, though the length of these placements varies. 9 out of 16 schools mentioned Indigenous facility leading curriculum design, and at least 6 out of 16 schools have recently created a leadership position for an Indigenous health expert to lead reform efforts at their school. This is great progress towards completing this call to action. The government has provided the Truth and Reconciliation Commission of Canada over 5 million records to create a historical record of residential schools, which makes our knowledge of Indigenous history more accurate. This is extra support to create a path of reconciliation.
The only way to gauge the effectiveness of this progress, though, is from real-life stories on the experiences of Indigenous peoples. That is why, throughout this presentation, you have seen stories from Indigenous citizens, as well as an interview with Michelle Fuller, a family member of mine.
My name is Michelle Fuller. I'm Shimshan, Giksan, Scottish and Irish. My traditional name is Lakshiel Unluck, which means sit at the edge of the fire. I inherited that name at my grandmother Marie Ryan's memorial feast.